your pregnancy sickness survival guide. If you're in the early stages of pregnancy or you've been affected in the past, you will know just how debilitating pregnancy sickness can be. There is a huge spectrum from people affected by mild nausea to those who are hospitalised for months with the severest form of hyperemesis gravidarum. I'm Brooke, an obstetrics and gynecology doctor and also a recent sufferer of severe vomiting in pregnancy. So I'm here to give you a guide to get you through this challenging part of your pregnancy. In this video, I will talk about what pregnancy nausea and vomiting can involve, what treatments are available, whether you have to be cautious of taking these medications in pregnancy, and some tips about what to eat and drink to help with the symptoms. Nausea and vomiting in pregnancy is a common condition. It affects approximately 70% of pregnant women and people who are pregnant. About 40% have vomiting with nausea, whilst an additional 25% have just the nausea alone. A more severe of nausea and vomiting in pregnancy is a condition called hyperemesis gravidarum, which affects approximately 1 to 1.5% of pregnancies. For the majority of people, the sickness improves around 12 to 14 weeks, but for others it can persist until 20 weeks or even beyond. Morning sickness is a very inadequate term to describe this condition because it usually occurs both before and after midday, and this term does not do justice to the range of severity that can occur. I prefer to use the term nausea and vomiting in pregnancy, NVP. This topic is one I get contacted about frequently, and its effects can be profound and persist far beyond the end of the pregnancy. I've been wanting to share some useful tips for a while, but it was since experiencing nausea and vomiting in pregnancy myself in the second and now third pregnancy that it felt even more relevant. Much of the information that you find in this video has come from a combination of the RCOG Green Top Guideline and the brilliant resource that is the Pregnancy Sickness Support charity website. So what is hyperemesis gravidarum? So this is when the nausea and vomiting has become so severe that a woman loses over 5% of her pre-pregnancy weight and becomes dehydrated and depleted of nutrients. The causes of hyperemesis and gravidarum are not completely understood, but many people believe that it's a combination of hormonal factors that affect them and cause these symptoms, but its effects are not just limited to the vomiting itself, and it can be deeply traumatic with implications on your mental health, finances, practicalities like childcare, as well as the physical symptoms. If you can't go to work, you can't look after your kids, can't do basic tasks like cooking and laundry, it can deeply affect the structure of your life as well as your mental health. So what are the risks of untreated nausea and vomiting in pregnancy or hyperemesis? Well, firstly, dehydration and malnutrition. So people experiencing any degree of hyperemesis are at risk of dehydration and malnutrition. There are other more severe complications that can occur, like blood clots and metabolic problems. If the vomiting is so severe that you cannot keep down any fluids and with more than 5% weight loss or showing effects of dehydration, such as the strain on your kidneys or your liver, then you might need to be admitted to hospital for intravenous fluids. Next up, the psychosocial consequences. So hyperemesis gravidarum can have profound psychosocial consequences such as loss of your identity, social isolation, feelings of guilt, and even suicidal ideation, and a pressure or a desire to actually terminate even a wanted pregnancy to bring an end to the symptoms. Up to 20% of people who suffer can also experience post-traumatic stress symptoms. Families can experience financial hardship, strain on their relationship, and difficulty caring for their children, as well as a sense of grief over the loss of a normal pregnancy experience. Next up, the risk of low birth weight for the baby. Now, surprisingly, despite the severity of the symptoms, baby is usually relatively unharmed because they will always receive the nutrients and water before they're received by the mother. However, in severe hyperemesis gravidarum, the growth of the baby can eventually be affected. So what can doctors prescribe? Well, whilst it's difficult to perform trials of medications on pregnant women, all the available evidence that we have, which is reported by the Cochrane reviews and other systematic reviews, meta-analysis, the best types of evidence, show that many of the anti-sickness medication that we use for nausea, vomiting in pregnancy are safe. They do not demonstrate any increased risk of birth defects or other adverse pregnancy outcomes. So some of these drugs that you might have heard of or might be prescribed include a family of drugs called antihistamines, which might include medications like promethazine or cyclizine. Then there are dopamine antagonists, which include metoclopramide and domperidone. There's also good safety data for another medication called ondansetron, but there has been previous suggestion of a slight increase in risk in fetal cardiac defects, but this is still controversial. That's why it's on the second line options. So the RCOG guideline I mentioned earlier has much more information about a lot of these. So doctors typically recommend starting with a single type of anti-sickness medication medication and gradually adding more, progressing up the ladder in a stepwise fashion. It's not uncommon. You need to take 2 or even 3 types of medications. It's important if you take any anti-sickness medications to take it regularly, even when the nausea seems to have eased, in order to stay on top of it and keep a steady level of control over the symptom. You can get these medications from your GP or your early pregnancy unit, and if you feel like they aren't working, make sure you go back for another discussion, because there will be more options you can try. So getting enough fluid. It's very common to find it difficult to drink water or keep it down. You may have to become quite creative about how to take your fluid. So here's some ideas like Lucozade, milkshakes that you try to thicken, juice like orange or lemon juice, ice cubes that are made out of flat coke, and ice lollies, and you might find it easier to drink sips of tepid water or continually sipping small amounts of fluid through a straw or even holding fluid in your mouth. So what to eat? Now, it can be helpful to initially keep a note of what times of day that the nausea and vomiting happen, so that you can try to identify and predict when it will be. It's a good idea to eat at your nausea-free times and eat immediately. So if you're feeling hungry, you get in there before the nausea and the vomiting starts again, and try to have frequent small meals, so 5 meals a day. Stop eating when you feel full. Have snacks on you all the time, and that might be crackers or dry crisps or nuts. And importantly, allow yourself to eat your cravings. Focus more on being able to take in sufficient calories by eating whatever you can that will stay down, rather than worrying about the balance of your diet. Of course, it's important, but it can be almost impossible to stick to an ideal diet when hyperemesis is at its worst. So whether you're able to eat or not, make sure you're still having plenty to drink in small, frequent quantities. Avoid more than 3 cups of tea or coffee a day, because you can find the caffeine worsens the symptoms, and it's also important to reduce your caffeine intake in pregnancy. And when solids do become more bearable, try some things like tinned fruit, ice cream, frozen orange or grapefruit segments, crisps, fish fingers or other salty or potato-based foods, and soda bread. And generally go for foods with a high water content if you can, like melon, cucumber, apple, as a good way of taking in extra fluids if you're finding it difficult to drink water. It can be very isolating when you cannot confidently leave the house, never knowing when you need to be near a toilet. Well-meaning friends and family may not know what to say or how to help. So I recommend checking out the Pregnancy Sickness Support website and also their Facebook page to help to connect you to other women who've been through the same or who are going through it right now. Odours. So if odours and smells are bothering you, then maybe choose to eat cold food, and maybe your family will do the same. Smell of cooking, especially with fatty foods or coffee or cigarette smoke, are the most common things that people that have nausea and vomiting in pregnancy struggle with. I personally found I couldn't go past the butcher in the first trimester. So it might be time to call in favours from your friends and family, buy what you can online or buy it pre-prepared to avoid odours. When it comes to employment, studies have shown that up to 30% of pregnant people in employment need to take time off in that first trimester due to nausea and vomiting in pregnancy. This shows how significant the condition can be, and know that you're not alone in needing to ask for time off. It's temporary, but it can be very debilitating. Accept whatever help you're offered, especially when it comes to managing your daily routine or your household tasks. Don't beat yourself up. You're not alone in this. It's important that you do rest, because you cannot work properly even if you're feeling like this. If you've had to be off for more than 7 days, you can ask your GP to give you a sick note that indicates you're unfit for work because of a pregnancy-related illness, and you can give that to your employer. If you do take sick leave for a pregnancy-related reason, you're entitled to receive the same sick pay as other employees. If you're planning another pregnancy after hyperemesis, know that the rates of recurrence vary wildly, but some studies show that it can be up to 80% chance of it coming back again. So once you've had an affected pregnancy, it's best to prepare for a future hyperemesis pregnancy. With planning, you may feel more empowered to cope with the condition and therefore experience less associated trauma despite the recurrence of the symptoms. So here's some ways you can prepare. Number 1, physical preparation. So you try and establish a healthy pre-pregnancy weight and fitness level. Number 2, think about prophylactic medication. So if you know what worked in your previous pregnancy, you don't have to wait until the symptoms start. You can ask your doctor to prescribe them in advance so that when the symptoms begin, you can take them right away. You might also need to discuss with your doctor what you might need to put in place. For example, being able to have IV medications on an outpatient basis if you had to go into hospital for IV fluids and medications before. Social preparation. So if you know you may well have these debilitating symptoms, you can talk to your family and friends and how you might manage with childcare and work in advance of the pregnancy, so that there are people around you when you need them. If you've got any other helpful tips for expectant parents, please leave them in the comments for others below.